Here is a little voiceover for trigger point work, which I use with my clients and also for myself to heal from injuries, help break up scar tissue as best as we can from the outside. And here I'm using a lacrosse ball, but I also use a foam roller, I use the Versa wand, and also a lacrosse ball. So we're putting it here in the glute, and you're looking around for a trigger that feels like it could be alleviating pain somewhere else. As I tell a lot of my clients, where the pain is not always where you do the massage. And the reason why I prefer trigger point or physical therapy work for injury is because it focuses on the muscle that needs to be worked on as opposed to releasing all the muscles and leaving the body destabilized. So here, I like to massage the lacrosse ball or foam roller right to left because those are the grains of the Piriformis. And I do what I consider to be nerve flossing, but let's use that term lightly. It's methods I have learned and then I fuse into what works for me. And I'm not here to prescribe or diagnose what will work for you, but you can try these techniques. You might need to move the lacrosse ball around a little bit to find a nice trigger. I do a lot of gesturing work. That's how I describe the leg movements that I do. And a lot of weaving and massaging, almost like a rocking the boat sensation. So now that I did some description, I'm just going to let you guys watch and try out some points. When you find a tender spot, hold. Honestly, 30 seconds is the minimum. You need to hold upwards of 90 seconds, and I can't stress enough that I don't recommend just rolling over the muscles. You could smush them all together. I recommend weaving through the fibers so that you're actually opening up the knot and not just mashing all the muscles together. Also, I recommend doing all of the gesturing leg work because where you move that leg might bring a muscle or an area to the surface where then it is a better trigger for you. I also want to mention and make sure that if you're starting this type of work for the first time, or if this ever happens to you, if you start to feel a burning sensation and it running down your leg, in my opinion, you're on a nerve, and nerves do not like to be pressed on or aggravated. So that is a time to stop and check in either with your physical therapist and or your trainer. You want to stay where it feels like the work you're doing is helping release tension in your body. I describe it as tension you didn't know you had. And some of my clients will say it hurts so good. Just describing this motion, I turn my leg out. I put pressure to the right side here because I'm working on the right glute area. I work all around the glute. If you do need to Google the Piriformis and see where it attaches onto the pelvis, that's probably helpful knowing where the muscles are in the body. But I slide the leg into a bent knee turnout, like a chair position, but over to its lateral side, and then slide the leg back down. You can also turn the leg parallel and turn out in the straight leg position. And then also you can just lightly bend and stretch the knee like you're flicking a bug off of the toe, just gently rocking at the knee. And then again, when you find a spot that is working for you, hold that 30 to 90 seconds. If all of a sudden it releases and you need to move the ball, if you really listen to your body will crave the ball to move to another part, another area. But you have to really have that mind-body connection in order to feel where the ball needs to go. So you can see here, I'm just moving around from the knee to the ankle to find different spots. And I will do this type of trigger point, and what works for me is multiple times a week. And then I will give it a break, whether it be because I'm sore, maybe even on the muscle or the skin that is near the area I was working, or my pain has decreased considerably. I might leave it alone, focus on strength training, and then go back to it as needed. Basically, if you need it, make sure you're staying regular, and if you don't, you can lay off it and just enjoy exercise and enjoy movement. As soon as you feel the beginning of the pain starting again, you should get back on whatever is helping you decrease that pain. Once I'm done with the area, I will test the move that felt painful. If I decrease the pain, these are all my opinion-based statements, I feel I was in the right trigger point area. If it did not decrease my pain, I look around again. Test out your pain before you do a full 20 so minutes, 15 minutes, however long you work on your body. Make sure that you're in the right trigger point before you continue by testing out the motion. You should feel reduced pain. It just depends on for how long. It could come back the next day after you sleep in a funny way. It can come back if you have poor posture. It can come back if you don't strength train. All these reasons. So listen, hopefully this helps you. When you're done, stretch out your body how you feel comfortable. And if you have any questions, you can always contact me, and I can help you in any way that I can. And I'll end this video by saying hardwood floors, firm flooring is going to be really challenging. You can start on a bed or with your trigger point lacrosse ball or tennis ball in a sock or a towel over it. Those softer surfaces will keep it on the lighter side. Here I'm testing out my motion that usually gives me pain or clicking, and it was better. Have a great day.